Hello, my name is Benjamin Hummel. I am an illustrator, and I'm also known as the Perspective Professor. Now, you may notice that I am not in my studio right now. I'm actually at UC Health Anschutz Hospital in the Interventional Radiology waiting room. If you want to fully understand my story, you have to understand that this is also a part of me. You see, I was born with an aggressive autoimmune disorder, IBD-PSC. This is a disease of both the gut and the liver. And when I was 15 years old, I had 2 liver transplants. Unfortunately, this is a disease of the immune system. And so my entire life has been defined by multiple hospital stays, midnight runs to the ER, severe itching, and pain. Many days were spent in the hospital when I was a child. And of course, that leaves a lot of time for a bored kid to try to figure out what to do. So what I ended up doing? Well, I picked up a pencil and I started drawing. And I eventually became kind of good at it. As the PSC wrecks my liver, treatments include drug therapies like Actigol and vancomycin, and painful biliary drainage tubes. However, at some point, the disease outpaces the treatment, and as the liver deteriorates into cirrhosis or worse, the only option left is a liver transplant. The chances are great that as you are watching this video, I'm either on my way to having a liver transplant or I've just received one. This would be my 3rd liver transplant since childhood. The procedure is very risky, especially for 3-timers. It also means a tough recovery with a lot of downtime. Leading up to the transplant, my symptoms included extreme fatigue and irregular sleep patterns due to the severe itching. The last several months, I have struggled to function. The potential restoration that will follow transplant recovery is very promising. However, until then, I've not been able to hold full-time work for a while. We have struggled to maintain a simple budget. Between medical bills, loss of work, and various treatment and recovery options, any help that we can get will be very much appreciated.